Good afternoon. I'm Dr. Ahmed Zaghloul from the Ministry of Health in Egypt. I work for the Epidemiology and Surveillance Unit. And this study was done in 2013. It was aimed at two important questions. The first one is, what are the population beliefs about the efficacy of injection as a treatment? And for the second question is the prevalence of unnecessary injections in Egypt. Let's start by an introduction for a study done by WHO in 2000. The injections used in the developing countries, they found out that about 25 to 96% of the outpatient visits resulted in injection, and 15 to 50% of the injection equipment were reused and unsterilized. 56% of the prescriptions included injections. 70 to 99%, almost all of the injections were unnecessary, and the injection per person per year ranged from 1.2 to 8.5. In Egypt, we done the same study in 2003, and we found out that there was high frequency of injection use. We used around 281 million injections per year. 26% of the patients interviewed received an injection in the 3 months prior to the visit to the physician. The injection use, or the injections per person per year, were around 4.2, and 8% of the providers didn't use new syringes. In response to the previous findings, the Ministry of Health developed the Infection Control Department to promote the injection safety and to reduce the injection overuse. But the necessity of injection in Egypt has not been studied before this one. We had our objective to estimate the prevalence of the unnecessary injections in Egypt and to identify what are the population beliefs about the efficacy of injections, and to assess the knowledge of prescribers, which usually is the physician, injection providers, the nurses, and the population towards the diseases transmitted by injection. Okay. We thought that a significant number of medical injections given in Egypt are not necessary, and the prevailing attitude of the population that they prefer to have injection as a treatment. For the methodology of the study, we followed the WHO guidelines for injection practices, rapid assessment and response guide for a cross-sectional study. The sampling included 2 stages. The first stage was to sample for 20 primary healthcare facilities. From the list of primary healthcare facilities, we chose 4 governorates in Egypt. And the second stage was to select a prescriber, injection providers, and members of the general population from the primary healthcare. The sample size was identified by WHO guideline to have 20 prescribers, 40 injection providers, and 400 of the population. And to have, for the unnecessary injections, we had to review 600 prescriptions that were revised according to family medicine guidelines in Egypt. The selection of governorates. Egypt is divided into 4 main sectors. And from each sector, we chose only 1 governorate. And for the selection of the primary health cares, in 5 primary health cares, in each governorate, these were selected randomly from a list of all primary health cares in that governorate. This is Egypt. These are the divisions of Egypt. We have Upper Egypt, Lower Egypt, urban area, and frontiers. And from each area, we chose only 1 governorate. These were Aswan, Arbeya, Cairo, and Red Sea. And from each of these governorates, 5 primary health care were selected randomly from each governorate. For each one of the primary health care facilities, we chose 1 prescriber or a physician, and 2 injection providers, 2 nurses, and from the population, we met 20 participants. 30 prescriptions were revised for the same prescriber that we had interviewed. A structured questionnaire for interviewed personnel for the prescribers, injection providers, and the general population was made, and a line list for prescriptions that were revised by a family physician specialist to identify if they are going according to the guidelines of primary healthcare in Egypt or not. Data analysis was done using Excel and ABM7. We defined necessary injection as it is either a vaccination or it has a therapeutic indication according to the guidelines, and it has no alternative. Safe injection was not for this study, but it is going according to the infection control program guideline in Egypt. The results for the population survey, we found out that about half of the population had injections in the 3 months prior to the interview. The mean of injection was 4.6 injection per person per year, and 97% knew 97% of the injections were using new syringes. For the population belief, we found out that for the population, 29% of the population preferred injection as a treatment. And according to the prescribers, when they were asked about what does the population prefer as a treatment, they thought that 39% of the population preferred injection. For the population beliefs, also 96% of the population knew that unsafe injection can transmit diseases, whether or not they knew what are the diseases that can be transmitted or not. We chose 3 diseases, HIV, HPV, and HCV. For assessing the knowledge of the population, the prescribers, and the injection providers. And 23% of the population knew that HIV can be transmitted by unsafe injection, while 24% knew that HPV can be transmitted, and 46% knew about HCV. For the physicians and the injection providers or the nurses, the self-mentioning of the transmission of HCV, HPV, and HIV was according to this table. We noticed that prescribers or physicians mentioned HPV. Only 65% of the physicians mentioned HPV, 45% mentioned HIV, and 43% mentioned HCV. While on the injection providers, on the otherwise, the percentage was higher for HCV, 87%. For HPV, it was 40%, and for HIV, it was 30%. The prescription revision, we used an indicator from WHO. It is called OT8, and OT8 takes the prescriptions with at least 1 injection over the total number of prescriptions surveyed, multiplied by 100. And for the prescriptions revised, it was around 19% of prescriptions included injection, at least 1 injection in the prescription. Antibiotic injections represented 62% of the overall injections, and unnecessary injection of the overall prescribed injections were 93%. In conclusion, we found out that high prevalence of unnecessary injections was identified in Egypt at primary healthcare units. The use of injectable antibiotics is high, and the knowledge about HCV, HPV, and HIV transmission by unsafe injection is low among all categories. 1/3 of the population preferred injection as a treatment of fever, even though they knew that injection can transmit diseases. What we made as a recommendation, the first recommendation was the training of prescribers on the guidelines to reduce the use of unnecessary injections and injectable antibiotics, and the continuous monitoring and evaluation of the injections in the physician's prescriptions is needed, and public health education about the risk of the diseases transmitted by injection should be done to the public and to the healthcare workers. Thank you.
So the floor is open for questions.
Thank you. It's a really interesting and quite dramatic finding. clearly you've identified a set of recommendations. I think one of the things that would be interesting in terms of perhaps strengthening the policy decision is looking at what the additional cost of those 93% of unnecessary injections are. Presume if you put together the cost of the staff time giving the injection and the equipment given, I would suspect that the costs associated with that are really considerable. Have you looked at that at all?
No, actually it was the first thing to study if the injections are necessary or not. So I believe that this will be one of the ideas to follow for the next studies. Thank you very much.
Thank you very much, Ahmed, for the very relevant study. Could you explain further about I think it was 3% that reuse the syringes? So what was the 3% that did not reuse? Do you?
We had this criteria to consider this as a new syringe. So the patient himself has to see if this was a new, to see the opening of it. So if he doesn't see the opening of the syringe, then we calculated it as not new one. Okay.
Well, I have a question about how do you interpret the discrepancy between what the prescribers think that the population wants in terms of getting this type of treatment versus what they think?
There was no big discrepancy. Actually, the population preferred, 29% of the population preferred injection, while in the physicians it was only 39. So it was not a big deal. We took fever as something to calculate the necessity of injection, because if someone got fever, then injection is not necessarily a medication. Medications could be oral. And by asking the population about what do they prefer, if they prefer an oral treatment or injection, or according to the physician, 29% of them prefer to have injection for fever. Yes.
It is now. It was mentioned at the beginning that this is World Antibiotic Awareness Week, and we've just had the European Antibiotic Awareness Day. And you say that most of these injections, the majority are antibiotics. Now, I'd be very concerned about what kind of antibiotic is being used, and clearly for some antibiotics you need recurrent injections, and so there would be a concern that actually it was a suboptimal regime being given, and whether or not this is contributing to the risks of the development of antimicrobial resistance, and that I think would be a really important issue to look at too.
Yes, it was not the main purpose of the study, but we do have a list of the used, we already have a list of the prescriptions, and all have been revised according to guidelines, but that was, the analysis of that was in a different abstract.
Yes, I was wondering that when you present the belief in transmitting some infection by injection, it seems that the one who injects the drugs, so meaning the nurse probably, are more aware than the prescribers, which is quite surprising as well.
They are more aware of HCV, and HCV is endemic in Egypt, so maybe the physician doesn't really look for it, except if it's among the disease he sees every day. But for the nurses, for the population, they're already aware of the problem. And maybe this was the explanation of the high percentage among injection providers.
Thank you. Thank you
you.
very much.